let's talk about Mia Femtech. I'm so excited. I am going to be one of the first, if not the first person in the UK to get the new Mia Femtech procedure done. So Mia Femtech is innovative, minimally invasive breast enlargement procedure, essentially. And unlike traditional breast enlargements, it's designed for those who are looking for more of like a subtle increase, so 1 to 2 cup sizes, and there is no scalpel, there's no sedation. It's like a local anaesthetic, really small incision breast enlargement procedure. It is so exciting, and I'm really looking forward to having it done. So if you know anything about breast enlargements, they usually have to cut like a 3.5 centimetre incision underneath the breast, and then they put the implant in under there, and you are left with a scar. Quite a big scar actually, and if you're smaller chested, or you're only having a small uplift or enlargement, then you may still see the scar and incision mark because your breasts don't sort of hang down and cover it. Whereas for this Mia Femtech procedure, it's a 2 centimetre incision just in the crease of your armpit. No scarring, no scalpel on the breast or breast tissue, everything stays intact from that perspective. So you are like in and out in, you know, it's a day procedure, like a couple of hours. I think the actual procedure only takes about 15 minutes and like 90 minutes or so in total once they do all the marking and stuff like that. But it's local anaesthetic, so you just, you know, have a muscle relaxer more than anything, just, you know, to settle you down, but you are awake, which makes the recovery time much quicker and just makes it a much easier procedure to have done. So come with me. We are going to be going on this journey over the next couple of weeks. We're going to be going through the pre-op assessment together. We'll then go and have the procedure done together, and then we'll do the aftercare journey together. So I'm just on my way to my pre-op assessment. I left work and I'm just heading towards the London Fitzrovia Hospital, where my procedure is actually going to take place next week. My procedure is being done through the Iconic Clinic, and the surgeon is Adrian Richards, who's one of the UK's leading breast surgeons. So I've been to the London Fitzrovia Hospital when I initially came for my first consultation, when we done like the initial sizing appointment, and when we had our initial conversation about it. To give you a little bit of background as to how I came about having the Mia Femtech procedure done. So I'd always been really interested in having breast enhancement surgery, and when I inquired about it several years ago, I was sort of told maybe it'd be best to hold fire until after I'd had children, as you know, your breast can change through pregnancy and after birth and stuff like that. You know, it may get bigger, or you may decide that you need an uplift rather than an enhancement. So I sort of put it on the back burner, and I sort of just decided maybe a couple of months ago now, that now would be the right time for me to get the procedure done. So I you know, I just thought, I've got 30 odd years left in this body now, I may as well be happy with it. And you know, I'm not really getting the procedure done for anyone other than me, you know, feeling happy and confident in my body. I don't really have any problems when I'm wearing clothes, but I just lack some confidence, and you know, I'm not 100% comfortable when I'm out of clothes. You know, bras are amazing and they can do incredible things. So when I'm dressed, I don't really have any problems with how I look or how I feel about myself. But when I'm not in underwear or I'm in swimwear, that's usually where, you know, I don't feel 100% confident and comfortable in myself. So I got back in touch with the clinic, and I'd known of Adrian Richards, the surgeon, from, you know, when I'd previously looked into it many years ago. and I was originally just inquiring about a regular breast enhancement procedure, and I was speaking to them and I was just explaining to them exactly what I wanted, in the sense that I just wanted something that was natural and noticeable, and I didn't want anybody to look at me and think I'd had anything done ultimately. So I was speaking to them about it, and then the lady sort of was saying, hey, have you maybe thought about having this new procedure called Mia Femtech? And I thought, oh, well, that sounds a bit interesting. So I went away and done a little bit of research, and I couldn't find much information about it, certainly not coming out of the UK anyway, which then made sense because it's not currently being done in the UK, it's just being done in like the Middle East and a couple of countries in Europe, so they're just bringing it over to the UK now. But the information that I could find about it, you know, it sounded amazing, you know, minimally invasive, like no downtime, no like actual scarring or incisions done on the breast. So you know, all the stars aligned. I just thought this literally sounds perfect for me, and that's how it started. So I'm just arriving at the London Fitzrovia Hospital now, and yeah, we'll see what happens. So I've just finished my pre-op assessment. It was essentially height and weight, blood pressure, some blood tests, and they had to do some swabs for MRSA, so had to do a swab up my nose, and they actually had to take a swab under the armpit where the incision will be for the implant when I have it done next week. I also have to do a COVID test 24 to 48 hours before my procedure, and then send the results over to the clinical team here. It was really great. I got to have a nice conversation with a member of the theatre team, got to have a look round at some of the rooms and like the ward, and they showed me where the theatre would be. And this is a really nice small private London hospital. So yeah, really exciting. I'm now gonna get on my way home. The next thing I need to do, I just need to complete some forms when I get home, just like some more consent forms for the procedure, and that's about it really until next week where I take my COVID test. So obviously on the day I'll be travelling up to London in the morning. I have to get to the clinic for 9 AM, and then I will go through sort of the marking procedure where they mark for like the incision places and things like that, just to make sure that they've measured everything correctly and they know what they're doing. Obviously no incision on the breast, just incision in the armpit. And then I will be going for the procedure, you know, shortly after that. So I will check back in nearer to then. But yeah, exciting. So it's just after 8:30 and tomorrow I go and have my Mia procedure carried out, and I'm feeling okay, a little bit of nervous butterflies, but generally feeling good. I'm just trying to pack my bag, and my main priority is packing some snacks, as I'm not actually able to eat or drink coffee or anything like that before I go in tomorrow. And that's because they do give you a sedative muscle relaxer, which can make you feel a bit nauseous. So they'd rather you just not have anything at all, just in case you have like a less than positive reaction to it. Also after today, I'm not able to like shower or anything for a week, just while the incisions in my armpits heal. So I absolutely washed my hair, and I'm gonna have to rope in my husband or a friend to wash it again for me in the next couple of days. But the main thing that I'm sort of concerned a little bit about is the logistics of like looking after the kids and stuff after tomorrow. They do say to take it easy. Obviously there is like not as much downtime as there would be with like a regular breast enhancement procedure, but like you don't want to go like lifting a super heavy child up, so that is going to be a negotiation. But really excited. I just can't wait to get going now. Don't really know what to pack. I'm going to take like a shorts and a t-shirt or something, and they're going to give me a like a sports support type bra, which I have to wear for 3 weeks or so.
and then after that I'm free to go and do what I want. So come with me tomorrow. Hopefully I get a good night's sleep, but really excited. We're gonna go tomorrow and have our Mia procedure carried out. Woo! So it's 5 AM and I cannot say I slept very well, but still generally feeling quite good. Just gotta get everything sorted this morning, get the kids off to nursery school, and then we'll be on our way. So just walking to the station now, and then gonna jump on the train to Waterloo, and then getting the tube over to Warren Street, and then about a 5-minute walk to Fitzrovia Hospital. So we'll probably be there in just over an hour. So it's 7:45 now, so we will be early, but we just dropped the kids off at their nursery and preschool, and then we'll just chill. I haven't eaten anything, haven't had a coffee or anything like that. A bit hungry, but yeah, let's go. So it's about 8:45. We've just got to Fitzrovia Square, so just gonna go to check into the hospital, get comfortable, and then yeah, meet with the consultant, have my sort of little check. I took my COVID test, which was negative, brilliant. And then yeah, I'll find out what happens next. So I've just checked into my hospital room and it's so cute. There is a little Mia gift box on the bed there and a card, and it looks rather chic with that fetching pink rug throw thing. They've now told me I need to change into a hospital gown. They've given me some disposable underwear I need to put on, and some socks, which is what I need to wear instead of my flip-flops that I've got. I need to do a pee sample, and they've just redone my height and my weight. So yeah, I'm just gonna get changed, wait for them to come back in, and then we'll go from there. So I've just put on my gown and my robe. A nurse has just come and taken my food order for after my procedure, which is a lovely surprise, as I had just banked on having my banana and my oat bar. So that is something to look forward to. This room is really cute. I've got my little gift box there, and I've just had a quick peek inside, and it's so sweet. There is a Swarovski pendant in there, a nice little box of Hotel Chocolat chocolates, which are my absolute favourites. I did know that the Mia experience was, you know, like an experience. I wasn't quite sure that this is what I was going to get, so this is amazing. So I've just had all my marking done. 2 consultants came in, my consultant Dr. Richards and one of the Mia specialist consultants came in. So now I'm just about to put on my stockings, and then we are going to go down. So I've just come back up from recovery after having my procedure done, and I generally feel like really good. I was probably talking quite a bit of gibberish as they gave me like the little relaxer sedative thing. I got to have a quick peek after it was done, before I put on my support bra, and they look great. The incision honestly is tiny. All I could feel was like a bit of pressure when they were doing it. I can definitely already feel a little bit of swelling coming on, similar to a bit like after you have a baby and all of your milk starts to come in. That's the only thing I can relate it to. But I'm just waiting for them to bring me up some food. I'm so hungry. I've now had a cold glass of water, which was lovely. So I think I'm just gonna chill here for half an hour, maybe an hour. They're gonna do a few more obs, and the consultant is gonna come back and check everything over. And then that's it. That is Mia. So I've been out of my procedure now for about an hour, feeling good, getting up, moving around. I just thought I would show really straight off the bat what we're dealing with here. So you can see that really small incision, like this is obviously where they've done some of the marking. That's the incision, and then on that side, like, it's absolutely crazy to think that they have put an implant in through that tiny incision. All of this part of my arm at the moment is still numb. My chest is still numb. this is really super swollen. I can feel inside, it's just like fluid. And they told me that is really normal because they put all of the like anaesthetic and everything into you out the, like in that area. So I've got my support bra on, and this is just a band, and they told me that we keep this band on just to like restrict some of your movement. But yeah, this incision honestly is absolutely blown my mind to think that that is going to be the only thing, which is a telltale sign that I've had anything done, and it doesn't even look like anything. So really, really happy. I am still swelling, so my chest is feeling quite tight now. But I've been told to expect that over the next 24 hours or so, keeping up with the paracetamol just to keep the pain at bay. But yeah, really happy. So I'm just at the end of day 1 of my Mia procedure, and I'm still really feeling good. I'm just feeling absolutely exhausted now. Some of the anaesthetic is obviously starting to wear off, so I'm starting to get a little bit of pain, like nothing crazy, just at the incision site it's starting to be a little bit stingy. I've been taking my paracetamol, and I've got about 5 alarms set overnight for my ibuprofen and my antibiotic, but it's just been an absolutely wild day. I cannot believe like the incision size. It's just been absolutely crazy, but really positive experience actually. Like I feel good, like I sort of came home, as you've seen I've been like up and running, just knackered, still swollen, obviously feeling swollen, and I'm just really hoping that like I don't wake up in too much pain tomorrow. I have been told that it's highly likely I will. They call it like morning boob or something. Obviously you can see like here I'm still quite swollen and a bit red, but yeah, generally feeling good. So now we are on the road to recovery with our new Mia boobs. Yay! So this is morning after the day before, so day 1 of my Mia recovery, and I'm feeling pretty good. So I ended up sleeping on the sofa because I just couldn't get comfortable in an upright position in my bed. So the sofa was calling me, and that worked out really well. I sort of set all my alarms and I took all my meds through the night, and actually by the morning I really didn't feel too bad, like a little bit tight, and the incisions are still a bit stingy, but apart from that, like a lot of the swelling has actually gone down, especially like in the armpits where it was, like you can see obviously I've got my support bra on and my strap still, but I actually probably feel better than I thought I would. I was built up to think that the morning would be quite painful, as usually is the way with any sort of like, even like an injury, like it always hurts more in the morning. So I've managed to have my little bath, which was really nice to just freshen up, and I sort of took off some of the markings. They gave me some alcohol wipes to get rid of that. Obviously you can't clean under your armpits or use deodorant, so I sort of just whipped out the baby wipes and gave them a little bit of a once over, and now I'm just enjoying a cup of coffee. I didn't even have one coffee yesterday, which is like really unusual for me, so just going to take it easy today. I don't feel like I can't do much, but obviously just like lifting up the arm like that is quite painful, so I'm just trying to sort of just do the robot dance. I did have obviously a look at them this morning, and I had a look at them yesterday outside of the sports bra, and my mind is blown. More so it's the fact that there's nothing on me at all that would indicate I've had anything done, and that's the biggest selling point for me. I think obviously it's minimally invasive, but when you think about it after, is, you know, I won't ever feel like I've looked at myself and can see scarring or anything, and the ones in the armpit will go really quickly. So yeah, now we're on the road to recovery, so I'm gonna start a new series, the recovery series, and then come with me, you know, over the next few weeks as I sort of just generally see how the healing process goes, and then just get back to day-to-day life. Like for me, exercise and being active is a massive part of what I do. I work out, you know, almost every day in one form or another, so I'm going to be keeping tabs on how I feel about that, and yeah, we just get back to normal with our new boobs. But yeah, thanks so much. Thanks for being part of my journey with me, and here's to the next few weeks of recovery. Cheers.